Okay, while we let people join, let me welcome everyone here, dear members, colleagues. Good afternoon, good evening, or good morning to those of you who are joining us from the Americas. Thank you very much for joining today. This is the webinar on allergen labeling. Today, we will explore several aspects of allergen labeling, the need for global harmonization, and the recent advancements in allergen labeling. So my name is Vedika Kayas. I'm the Scientific and Regulatory Affairs Officer at ISDI, and I will be your moderator today. Before we move into the program for the day, just a quick housekeeping rules. If you have any questions during the presentations or after the presentations, please feel free to drop them in the Q&A button on your screens. We will be addressing all the questions after all the presentations are done at the end. We have a dedicated Q&A section for that today. Moving on, just a quick look at our agenda or the program for today. I would like to introduce a bit of allergen labeling discussions at Codex Alimentarius, and then we will hear from our experts who are present here. Thanks very much for joining. So we will hear on allergen labeling industry implementation and challenges from Dr. Marie-Claude Robert, who is the expert on food allergens from Nestlé Research. We will hear a bit on the consumer understanding and trust in precautionary allergen labeling from Ms. Veronica Rubio, who's the Secretary General of AOECS, which is the Association of European Celiac Societies, representing the patients suffering from celiac diseases. And then we will hear on food allergen methods and precautionary allergen labeling from Dr. Melanie Downs, who's the associate professor involved in the food allergen research program at University of Nebraska-Lincoln. And afterwards, we'll have a dedicated Q&A session, as I mentioned. I am also accompanied here today by our communications manager, Hugh Longton, who will be making sure that everything is running smooth from the technical side of things. And if you're having any technical difficulties, please contact us via chat. With that, let's have a quick look at the discussions at Codex. Okay, before I move into that, for those of you who are not familiar with ISDI, we are an international federation and the leading global expert association representing the manufacturers, the industry of special dietary foods. We have members present in more than 20 countries, and we are representing truly the global industry of specialized dietary foods or specialized nutrition. Moving on, also a quick refresher on Codex Alimentarius. It's a joint FAO-WHO program, which is joined by 189 members, which includes 188 countries and one member organization. And one of the main aims of Codex is protecting consumer health. And when it comes to allergen management, allergen labeling, I think that aligns quite a lot with one of the major goals of Codex Alimentarius. And there's also a reason why we wanted to give an overview of what's happening at the level of Codex. And of course, Codex is involved in developing international standards and harmonization of food trade globally. Looking at allergen discussions at Codex, currently it is being covered in 3 different committees at Codex Alimentarius: CCFL, which is the Committee on Food Labeling, which is the main responsible committee for matters related to allergen labeling; CCFH, which is Committee on Food Hygiene, which is responsible for the matters related to allergen management via good hygiene practices for food business operators; and CC-MAS, which is the Codex Committee on Methods of Analysis, which is the main responsible committee when it comes to analytical methods for allergen detection. In terms of allergen labeling, of course, the most important and the main subject matter expert committee is the Committee on Food Labeling. Their allergen labeling particularly is covered in the General Standard for Labeling of Prepackaged Food, or the GSLPF. I know it's a bit of a mouthful, but that's the General Standard of Food Labeling, and that covers all the aspects related to allergen labeling. Specifically, Section 4 includes all the mandatory labeling for allergens, and then other sections like general principles in Section 3, exemptions in Section 6, and presentation of information in Section 8 also cover some aspects of allergen labeling. In the Committee of Food Hygiene, there is a dedicated standard or a code of practice actually for management of food allergen for food business operators, as I mentioned, which was quite recently adopted in the year 2020. And the main aim of this guidance is to provide guidance to food business operators and also competent authorities on managing allergens in the food production, which also includes controls as well as prevention of cross contact. One important point to mention here is that even though this code of practice was adopted quite recently, there was some pending work on precautionary allergen labeling. So it is expected that this code is going to be revised again soon once CCFL is done with precautionary allergen labeling principles. And as I mentioned, the third committee on methods of analysis is working on coming up with standardized analytical methods and sampling, which can be used for allergen risk assessment in foods. In particular, they are focusing on methods that can detect and quantify unintended allergen presence. And then it can also quantify allergen presence after removal of allergens. So to ensure compliance, that's one of the main goals of CCMAS, is to propose these methods that can be used for compliance purposes, particularly for precautionary allergen labeling. So I'm not going to go through this whole slide. Slides will be available for you later, so you can have a look at the details of what's exactly happening there at CCMAS. And then in terms of further development, so I covered where allergen labeling is being considered. And now I will talk briefly about what is happening at the moment in terms of latest developments. So a few years ago, the Codex Committee on Food Labeling actually decided to review and clarify the provisions which were relevant for allergen labeling. They also agreed to request some scientific advice for this purpose from FAO WHO, which is the expert body when it comes to scientific advice. And then a joint risk assessment was conducted by the expert committee of FAO WHO, and they published a series of reports which are now all available on the FAO portal, and you can access that as well, which provides scientific information on assessment of allergens. Then after a few years of discussion, CCFL has recently, last year actually, updated the allergen labeling provisions, and they have been adopted by CAC last year, which are now already the changes can be found in the General Standard for Food Labeling. However, another part of allergen labeling is precautionary allergen labeling, and on that there is still ongoing work at CCFL. The committee is at step 5 of the process, and it is expected that in the next 2 or 3 sessions, they will come out with the final version of guidelines on precautionary allergen labeling. In the end, these guidelines are intended to support competent authorities globally to adopt precautionary allergen labeling provisions. So that's a bit the overall update on what's happening at the level of Codex. After this, I would now like to invite our first speaker for today, Dr. Marie-Claude Robert, who will take us through the industry implementation of allergen labeling and challenges associated with it. So, Marie-Claude, the floor is yours.
Thank you very much, Vedika, for the kind introduction and the invitation for this talk. So I will be talking about allergen labeling. And as you see on the screen, there are many ways to communicate potential presence of unintended allergens to the consumers. And this is very confusing. So this is why, as mentioned by Vedika, the Codex has undertaken some work, which is now reflected, please, the next slide, in the standard 1. Can you move to the next slide, please? Yeah, thank you. So in the standard 1 now, the work has been done to identify which are the allergens that are priority allergens based on scientific criteria. So now it's established that the egg, fish, peanut, sesame, milk, Cereals containing gluten means wheat, rye, and barley, crustaceans, and almond, cashew, hazelnut, pecan, pistachio, and walnut are to be considered global priority allergens. The standard also mentions local priority allergens such as mustard, buckwheat, oat, soy, the Brazil nut, macadamia, pine nut, the lupin, and the celery as priority allergens, but to be mentioned at local level if authorities think this is necessary. But how does this reflect when compared to local regulations? So on the next slide, thank you. In the frame, you see which are the priority allergens. So we see that those are already reflected in many of the local regulations already, in particular the sesame, which I highlighted because sesame was introduced newly into the global list of priority allergens. So good sign, this is already introduced, and very good student were the USA authorities. They already have adopted the tree nut list according to what Codex recommended. Question mark, it will be regarding allergens that are mentioned below the list that is, or a part of the list of Codex. So typically the mollusks, will those be reviewed and be removed from local list of allergens? Question mark. If we want harmonization, response should be yes. And what about labeling exemptions? The Codex Committee, in fact, agrees about the parameters to take into account, so to define which should be the labeling exemption, but it seems to be a challenge to get to a list. So let's see how this evolves. But enough talk about labeling, so move to precaution allergen labeling. So I will just review where we stand. As stated by Vedika, this is still a draft. So in the draft, we see that everyone agrees that the decision to use PAL should be based on the finding of a risk assessment, which can include but is not limited to a quantitative risk assessment of unintended food allergen presence. We all agree on this. On the next slide, please. We also hear it's still under discussion, and many discussions are ongoing on this topic, whether PL shall or should, and whether it should only or not be used when it is demonstrated, or when the risk assessment can demonstrate that the quantity of allergen is in the food exceeds a certain threshold. And then the whole question is also about the threshold, how it's defined. For now, the proposal is to define the threshold based on two parameters. So this will stay because it is like this, but one of the parameters is the reference amount. At the moment, the proposal is to refer to a reference amount that is considering the 50th percentile of food, means 50% of the population would eat that amount of food, but this also means that we are underestimating the risk for the 50 other part of the population who might be eating more than what is foreseen. We will see that in an example. And also another point, another parameter that is taken into account into the calculation of the threshold is the eliciting dose, means the dose of allergen that will trigger objective symptoms. Historically, we were using the EDO1 reference dose, which triggers objective symptoms in 1% of the food allergic population. The proposal is to move to the EDO5 dose, which will trigger potentially symptoms in 5% of the food allergic population. You see that this makes quite a difference, meaning that the dose is multiplied either between 4 to 30 times. Can move to the next slide. Here also, everyone agrees, I think, on how this should appear clearly contrasting from the surrounding text directly under or in close proximity of the ingredient list, as with the well-known statement, which is may contain and the allergen name. We can move to the next one. So here I have an example. So for you to understand, which is the impact of the methodology and how this works. So I have a fictitious example with a cookie that has 2 ingredients and 5 different cross contacts. This precludes that the vendor selling the materials or the ingredients for baking this cookie knows which is the allergen content of the materials and shares this information. This is one first prerequisite. And then, as you see, as I mentioned, the reference doses, if we use EDO5, they will be increased. And here the example with the cookie, the P50 reference amount, so 50% of the population eats no more than 20 grams of cookie. But if you want to cover more of the population, you see that you almost double the amount, because if you cover 75% of the population for the amount that will be eaten, you go to 36.1 grams for the cookie. So we can calculate based on these different thresholds. And here I calculated based on the different combination of EDO1, a large reference dose, or EDO1, the lower reference dose, and so on. And you see in the end, comparing the more strict risk assessment to the one that is today proposed by Codex, you multiply this threshold minimum by 17 up to 50 times. And how does this reflect in the labeling of the food? We'll see on the next slide. And here you see the whole range, depending on the type of threshold you choose for your risk assessment. Either you base your risk assessment on a very strict threshold, and then you list all ingredients and all cross-contact. If you move to a less strict risk assessment, still considering a very strict reference dose, but a less strict reference amount, you lose already one cross-contact allergen. And going on in this, you end up with the less strict risk assessment as currently recommended by the FAO WHO expert committee, means only ingredient labeling. Here in that example, we see also that the parameter that plays a predominant role is the reference dose, not that much the reference amount. And for this, I come to the challenges, which is on the next slide. Thank you. Very important in our view is that the proposed reference doses are verified, because you may know that today the reference doses were modeled mathematically based effectively on clinical data, but there were only 2 single dose challenge studies for verifying those reference doses, one on peanut, which supported the data proposed, but the other one on milk showed that children reacted much more than expected to a dose that is 4 times lower than the one today proposed in the Codex draft. So this leads me to the next point. The fitness for purpose needs also some attention, because if one part of your population is not covered as precautiously as others, so all population age ranges and product categories must be covered by the risk assessment. I must in particular mention that the original vital risk assessment from the Allergen Bureau excluded food for special medical purposes and food meant for infants from the risk assessment scope. So this is also one point where the Codex committee should clarify their intent. Another point is about sensitive consumers. There was a draft publication by the WHO, so the World Allergy Organization, ACT UP team, which mentioned that a wish from the very sensitive population is to still have an overview whether food contains unintended allergens or not at all, because with the proposal, the current proposal, if PL, so precautionary allergen labeling, is applied only when exceeding a certain threshold, and you have seen that the threshold will be high, those who are very sensitive or do not want to take the 5% risk of getting an objective reaction might need to get that information somehow. So I also think they merit our attention. Finally, the Codex Committee is also expected to come up with reference doses for rye and barley, because there is still no proposal for proceeding with risk assessment, as well as guidance with regards to gluten-free claim, because there might be conflict in communicating gluten or wheat protein presence to those suffering from celiac disease, and at the same time to those suffering a food allergy. So this is also work ongoing. There are 3 other points that also merit our attentions. Alignment on reference amounts. Hope this will be done by the Codex Committee. Harmonization on ingredient labeling exemptions, as well as proposal on methods, and also harmonization reporting units from the method, because that is also a struggle when proceeding with risk assessment. I would finish my talk with saying that, on the next slide, please, that we hope that with all this work, people will be able, or consumers will be able, to trust again PEL. Industry is doing lots of effort to come to that point, but the risk assessment system will also to deliver on its promises and ensure that no more than 5% of the population will react with mild or moderate objective symptoms. And with this, I thank you very much and give the floor to Veronica. Veronica, we can't hear you, unfortunately.
Thank you so much, and thank you, Verica. Thank you, Marie-Claude. It was an impressive presentation. Thank you for giving me the opportunity to speak today. My name is Veronica Rubio, and I'm representing the AUACS, a very difficult acronym that represents the Association of European Celiac Societies. And I will be talking about our perspective on consumers' understanding and trust in precautionary allergen labeling, with a particular focus on celiac disease and gluten. This is important because while celiac disease is not an allergy, and I will emphasize that, patients are still directly affected by precautionary allergen labeling claims, as Marie-Claude has showed on her presentation. So a few words about who we are, and maybe next slide, please. AUACS is an umbrella association of national celiac societies, bringing together over 40 members across Europe, but also beyond Europe. And we work closely with celiac societies, healthcare organizations, and other non-for-profit to improve the life of people affected by celiac disease, but also dermatitis herpetiformis and other gluten-related conditions. A key part of our mission is to support patients in navigating food labeling and to provide trust through our gluten-free certification program. Maybe next, yes, it's celiac disease, as I mentioned, is not an allergy, it's an autoimmune condition that affect about 1–2% of the population, who are genetically predisposed individuals, and when eating even a small amount of gluten, that triggers the autoimmune reaction that damages the small intestine. That makes it very different from wheat allergies. So allergies can sometimes be triggered by proteins, and reactions are usually immediate. With celiac disease, the threshold for harm is much lower. The consequences are long-term intestinal damage, even if symptoms are not immediate, and sometimes they don't even show on. This different is critical when we talk about precautionary allergen labeling, because while celiac disease is not an allergy, people living with it is still facing the PAL statements on food packing and need to interpret it correctly to stay safe. So in the next slide, we can still emphasize on this difference to just like wrap up the distinction. Wheat is not the only source of gluten, and there is gluten that can be found in other grains like barley and rye. And as Marie-Claude mentioned in the risk assessment, those grains are not yet part of the risk assessment. Wheat allergy is a reaction of wheat protein, but there is not just gluten, and therefore people with wheat allergy might tolerate some gluten from other grains, like we have seen barley or rye, while people suffering celiac disease must avoid gluten in all sources, including wheat. And then we have the special case of oats that, even though it's naturally not containing gluten, it is frequently under risk of cross-contact with gluten during the processing and so on, which make it also an additional information that need to be included on packaging. The next slide shows that it is very important, trustworthy labeling, but also in our case, certification. And in that regard, we are, I think, as celiac patients, quite fortunate that AUACS offers that program to provide trust and confidence to consumers. So what are the experience we can share with you when it comes to patients' perspective navigating PAL? Again, in principle, these precautionary labeling statements are meant to alert consumers to possible cross-contact. So it's all good and with good intentions. But in Europe, but not only, we see that allergen labeling is not mandatory, but the precautionary statements remain voluntary. There is not harmonized wording, neither a harmonized format on where to find information. There are not thresholds that when PAL can be used. And what we see very frequently is that manufacturers often apply PAL as a disclaimer rather than something based on proper risk assessment. Next slide. We also see that in several research that consumers are inconsistent in the way they interpret PAL. So we have some consumers that consider a definite danger and will avoid that product. Others will disregard it completely because they might think, well, this is a disclaimer anyway, so I take the risk. And both responses undermine consumer safety and create more confusion. For celiac patients, that is certainly an additional challenge because, as it was mentioned, sometimes it might enter into contradiction with gluten-free claims, and that's why they are tending to rely on certification. And then on the next slide, we see as a nutshell, what we see is an overuse and lack of standardization. PAL is oftenly applied in a broad way, regardless the actual risk, as we said, more as a disclaimer, and with inconsistent language. Even it varies by region and by nation. We also see low consumer understanding, so consumers are uncertain of what may contain actually means, if it's a probable contamination or a remote possibility. And that represents like an erosion of trust and consumer confusion. PAL is often seen again as a legal disclaimer and not necessarily as a genuine food safety message to protect consumers' health. And then there is this information overload or labeling fatigue, I will say, that where packing is crowded with claims and symbol, and and therefore important risk information often get lost. How do we see, or what opportunities we see from the patient perspective? On the next slide, we see it feels that harmonization and standardization are key, and we see a great potential for stakeholders collaboration to convey the right message to the relevant institutions, like could be codex, like it's where we are observers, and also the European institutions. PAL should also be based on a quantitative risk assessment with clear threshold and consistent language that is easy, that is for the regular consumer on the street. We could probably explore the use of digital and technology tools, not instead of, but in addition to, like QR codes or blockchain or AI for what that matters. And then from the celiac perspective, we keep thinking that trusted certification schemes for gluten-free remain essential, again, as a support to clarity and food safety. Last slide will be that, again, ultimately, we strongly believe that PAL should help to protect health of people with allergies, but also people with celiac disease, and not put them in conflict. Ensure access to a fair variety of safe and also nutritious food, so that we are not confronted to impossible choices between safety and nutrition, and also that is affordable and realistic for companies and consumers. It needs to work for both, for the industry that is working and making a tremendous amount of effort, and for consumers, so that we can eat food that is safe and nutritious and is accessible to us. Well, so that will be me. Thank you for your attention, and I will stop here and looking forward to your questions afterwards. Thank you so much.
Thank you very much, Veronica. Those are really important insights that you've shared from the perspective of consumers, and we do hope that our listeners will take back that message as well. So we've heard from the consumers, we've heard from the industry, but now we will look into the practicalities of implementation of PAL. When it comes to compliance, analytical methods are extremely important. They play a very crucial role. So therefore, I would like to invite Dr. Melanie Downs from the Food Allergy Research and Resource Program of University of Nebraska-Lincoln to share the latest developments on allergen detection. So Melanie, the floor is yours, please.
Great. Thanks very much. And thanks for the invitation to participate today in the webinar. So again, we're going to be talking about allergen methods and how that relates to PAL. And I think the previous two speakers did a great job of setting up a lot of things that I'm going to discuss. So on the next slide, we can see one of the things that has not changed very much, to be honest, is really the core kind of types of methods that we use for food allergen detection and quantification. So that includes antibody-based methods, immunoassays. So a lot of people are familiar with ELISAs or lateral flow devices. These are used pretty commonly and probably the most common type of method that's used. But we do see some use of PCR, again, which detects DNA, and a little bit of growing use of mass spectrometry, which detects peptides from proteins from allergenic sources. So largely these types of methods have remained the same, but what we are seeing a change in as we go from a zero tolerance kind of perspective to risk-based approaches is a change in how the methods are used and how data are used from these methods. So when we're thinking about a zero tolerance space, as you can see in that box in the middle, if you conduct analysis, essentially you look at your results, and if they are above the LOQ, you have a problem. If they're below the LOQ, you don't have a problem. So whether you're using a quantitative method or a qualitative method, you get really qualitative results, right? So it's just above or below the limit of quantification. As we move to risk-based approaches, again, the concept of having an action level that is hopefully somewhere above your LOQ, so another concentration that you're interested in. And then the method needs to be able to measure accurately and precisely around that action level. So is it above or below the action level rather than a limit of the method, right? The limit of quantification. And one of the things, as Marie-Claude demonstrated in her example, is that the action levels are dependent on what product is being evaluated. So are you looking at a cookie or are you looking at a lasagna, right? Those have different consumption amounts, and that will lead to different action levels. So we're also looking at, not just one quantity that we're trying to detect. So this is a little bit of a change in mindset for how we're using these methods. But that being said, if we go to the next slide, some people think that means, well, we have to test everything all the time, and analysis is really absolutely necessary to be able to use risk-based approaches at all. And I would say oftentimes that's not necessarily true. So there are a lot of situations where risk assessments can be done without using specific food allergen methods. So a lot of times you can use calculations based on product and process information combined with things like total protein measurements of your ingredients. So oftentimes the risk assessment decision is quite clear, right? You either are on one end or the other. There are some instances where analysis can be helpful, some of those more nuanced decisions where you are close to a reference dose or an action level. And sometimes that may be necessary to then have some allergen analysis. Allergen analysis is still good for the things that we're using it for now, right? As a verification and validation tool for allergen controls. So, it's in a practical sense, a lot of the ways that allergen methods are used are going to be the same. Therefore, making sure your allergen controls work properly. But there's a little bit of heightened use, perhaps, for additional quantification. But you do want to avoid some traps when you're using allergen analysis methods, right? Testing just to test, and you don't know what you're going to do with the results. Also, making the assumption that all methods work in all situations, which is kind of tied to the next point. We really want to start thinking about, is a method fit for purpose in the way that it's being used, and will it give the quantitative data that you really need for some types of risk assessment? And again, there are some times where analysis really is not helpful, right? So for example, if you have a particulate allergen, you're really not able to test enough samples oftentimes to find those particulates. So you need to use other approaches in your risk assessment. And so again, that last point of, thinking that analysis is going to solve everything for a risk-based approach is really not true. It still has to be a very holistic assessment of your systems. So if we look at the next slide, there are, again, this fit for purpose discussion is really important. And we do still need to know a little bit about the methods that we're using, because they can differ in terms of what proteins they target, how they're calibrated in the reporting units. If we go to the next slide, we can also see there are a lot of different things and a lot of different processes that can impact quantitative recovery particularly. So if we heat foods, for example, a lot of times that can make the proteins insoluble, right? And almost all of these methods, the first step is to extract proteins. And so if you have a really highly heated system, or if you have some systems that contain matrix components like polyphenols, that can make the proteins insoluble and you have trouble with quantification. We can also see things like protein unfolding can impact quantification, as can fermentation and hydrolysis systems, again, because those can maybe cleave proteins in ways that make them less detectable. But if we go to the next feature, we have to remember that not detectable or lower quantification due to these factors does not mean that these proteins are now non-allergenic, right? So we have to understand how processing impacts our quantitative results. And so if we go to the next slide, there are a lot of initiatives attempting to work on some of these issues, including through AOAC International. So it's had a gluten and food allergens initiative for a number of years to try and start to get some of this information together, right? So the objectives are really to provide clarity on how, what the methods are capable of, how they perform in real life situations, and again, really try to enable communication between the people that develop methods and the people that use methods. So as an example, on the next slide, one of the things we developed was validation guidance for food allergen methods. Again, there's a number of things in here, but we'll just highlight some. And again, in good alignment with Marie-Claude, who mentioned that, you know, reporting units are really important for methods, and we're trying to encourage that through AOAC to make sure that we have reporting units of milligrams total protein from the allergenic source per kilogram matrix, so that those results can really be used pretty directly in risk assessment. And again, we also have things like incurred food matrix requirements, so incorporating the allergens into your test material and then performing whatever food processing it would undergo, baking, frying, etc., to make sure we really understand, if you're doing finished product testing, for example, what should you expect in terms of quantitative recovery, etc. So if we go to the next slide, where we also have efforts underway to say, well, then how should people be implementing these methods? We're calling that our end user guidance. So it covers things like method verification. You know, how do you make sure you are using the method appropriately and it works for your particular matrix? And that work is currently underway. And then we will hopefully move on to additional topics like sampling guidance and data interpretation. And again, the goal here is to make sure that on the method side, we're also doing everything we can to help harmonize and communicate how the methods are going to be useful for these new risk-based approaches. So I think that's it. The next slide. Thanks very much for your attention. And I think we have a Q&A session next.
Yes, you're correct. Thank you very much for that very interesting insight into the use of an appropriate use of methods for detection of allergens. To our audience, please feel free to drop your questions through the Q&A button, which would be somewhere at the bottom of your screen. While we wait for questions from our attendees, maybe to start off, it's a question to all of our speakers here. We talked about precautionary allergen labeling, so I just wanted to see if there are any risks involved with the misuse or overuse of PAL, and how can we ensure that it remains meaningful to consumers, because in the end, it is important that the consumers are the ones that are benefiting most from this PAL. So please feel free, you can.
Suppose the question is rather for me first, and maybe Melanie or Veronica can complement. Yeah, I think it's reliability, that everyone is doing his job correctly, I would say. Yeah, as we are used to say within Nestlé, safety is everyone's job, I would say. So the same here when you are producing a food. I mean, the one who is selling you the ingredient has also to be very well aware of what he manages, what he handles, where from his raw material is coming from, what are inherent allergens, what other unintended allergens can be present there, and not come up with effectively sometimes weird allergens that may fall from the heaven, and they are potentially there. So then it's also up to us to train maybe our suppliers, explain them what we want. But I think it's really everyone's job to ensure that the allergen content is well managed and well known, and if there are cross contact, this must be shared so that we can proceed with risk assessment. So I think cross contact don't have to be hidden. but they have to be openly shared if there are, and people must know what they produce, and yeah, acquire knowledge also, because I think allergens probably were not managed maybe at the level they should have, and yeah, suppliers may acquire more knowledge about allergen presence in their food, but yeah, that's continuous work to be done by everyone.
Yeah, maybe I can follow in those lines. I fully agree, Marie-Claude, with your the approach of a common responsibility, of a shared responsibility that each actor in the supply chain, but also the consumer, try to help together. So clarity, education from both sides. I think we need education, obviously, from the consumer to get across, but probably also manufacturers, and they really need to be genuine in what they are claiming, and try to work for the common good of consumers, but also keeping in mind that a great amount of those consumers also suffer diseases that for whom this food is very important and not disregarded. So I think, yeah, if we are able to work together and trying to find a clear message that then we can convey to both sides of the supply chain, we will have done an important progress.
Yeah, I think I would echo everything that the other panelists have said, and maybe just to add on, or maybe kind of re-emphasize that, you know, I think the goal is really clear communication about what those statements should mean, right? They should have a very clear meaning, and I think one of the challenges on both ends, perhaps, is that, you know, even as we move to a risk-based approach, the presence of allergens due to cross contact should or probably will be sporadic in nature, right? So food manufacturers should continue to do everything they can to remove any cross contact opportunities. And so, you know, I think for consumers, it's sometimes challenging to understand, well, why is it maybe there sometimes or not, even if we are using a reference dose, right? So those types of kind of nuanced conversations, I think, can happen more effectively if we all have the same definition of why you would apply that sort of statement, even if it doesn't mean it's, you know, the allergen is always there at a particular level, right? By the nature of food manufacturing, that will be a sporadic presence above that level. So that's, I think, another thing that will be maybe helpful to move us forward on communication.
Right. Thanks a lot. I think that brings together the message here along as well, that harmonization is extremely important when it comes to allergen labeling, to ensure that the common understanding is achieved, and we are all at the same line or at the same level. We have a question from the audience. Do you know when the European Commission will propose the PAL rules for EU? The Netherlands has already set local regulations. Yeah, we are aware of that. And it is probable that other countries will do so, will follow suit. So I don't know if any of our speakers know this at the moment. We don't have any information for the moment, but I think we can get back to you if we can find out something. It is a bit of a trend. We've seen Netherlands has been a bit of a trailblazer, we'd say, in terms of coming out with the new PAL legislation. But we do hope that there would be a harmonized EU or a global understanding on that. Codex is working towards it. They're not there, but they are slowly moving towards a more harmonized approach, and we hope that EU adopts something similar. While we wait for other, okay, we have another question here. It's open to all of our speakers, I think. What are your feelings around the two-tier PAL? So one PAL for high levels above the reference dose, and the other one for PAL for very low or trace levels. Will this help consumers, and is it feasible for the industry? I think it's a question for Marie-Claude.
Feasibility for industry, I would say if you have the money, everything is feasible somehow. So on the principle, I mean, it's clear how to calculate if we get information from the different food suppliers on how much allergen is present in the raw material. It's just a matter of doing the exercise and then printing the may contain statement on the food. So it's of course technically feasible, whereas you need to have the place to manage having the statement on the pack. Then what I hear more, but maybe Veronica can also add on this, I think it will be quite confusing for the consumers because they already have difficulties in reading those statements. But let's say if that would be clear to them, and anyhow, if authorities come up with such a requirement, I mean, industry will have to adapt. So it's technically feasible, of course. I don't know how then the pack will look like, probably quite awful because with the many statements, I don't know if the readability will still be ensured. This is another question. If that will help is really another question, because as also mentioned by Veronica and Melanie, training is much needed also for the consumers, for everyone to understand what PL really means and what it should mean. So if we come up now with 2 PL, but I would say industry should not be the driver there, consumer should be the driver there. If they want, they should get it.
Consumer and safety, right? So you're totally right that it's feasible for you. For consumers, my initial reaction is that will be more confusion. But again, if we train, if it's clear enough and we train people, eventually we will get the result. The problem is we have mixed messages in different countries, in different regions, and that it will be completely mess. So
I think coordination is again the one main word, and harmonization. So if the effort is coordinated and everyone agrees that two-tier messages are what is needed and what really is meaningful to the consumer, because the whole exercises is not meant to occupy industry. It's really meant for helping the choice of food for the consumer, for the sensitive consumer again. So effectively safety is the primary role to play there, but then consumer must have their final word also.
The only thing I would add is, maybe to look at some of the roots of that question, right? They're asking about, for instances where you have high levels above the reference dose. And so I think it's important for us, as food manufacturers, to understand, well, why would we have an instance where we have very high levels above the reference dose? And is that something that can be corrected through practices rather than through labeling? I think we always need to keep that in mind. What types of scenarios are we talking about where we need an additional type of information for the consumer, and is there something else in that root cause that should be corrected? So I think there's maybe a few specific scenarios that might apply there, and I think it's important for us to dig deep on whether those few examples should change how we do everything, or we should work on those specific instances.
Yeah, I agree with you, Melanie. Thanks for giving that more precise view. Effectively, if the context is not whether we use EDO1 or EDO5, or as I mentioned also the P50 percentile of the reference amount or a larger reference amount, if the question is about the quantity of allergen that might be present sporadically in a food, which might be, let's say, exceeding largely the reference dose, I would say here, technically, if it's an unintended cross contact, it should remain labeled as a potential cross contact, because we should not enter into the definition of ingredients. This will not be an ingredient either, else we were cheating on the consumers. And then if we are talking about this large amount, I mean, what do we want to communicate to the consumers? Either we state may contain, and this means that this food is not meant to be consumed by a sensitive consumer, and that's it. And whatsoever the amount the consumer takes a risk that is larger than either EDO1, EDO5, whatsoever the future reference dose will be, but than the agreed threshold, let's say, or not. I think one unique way of communicating this risk to the consumer is necessary. So in that sense, effectively, thanks, Melanie, for your view on this. I would not support going for two-tier approach.
Right.
Yeah, I think there have been a few different iterations of what a two-tier approach would mean. So I think now we've covered both ends of the spectrum on what those tiers could be. Yeah.
Right. Maybe this a last question for Melanie. How do you think can scientific advice better inform regulatory decisions on threshold levels for allergen labeling?
Yeah, so I mean, I think the more data we can have published and the more information we know about, both how, for example, like, allergens are distributed in real life situations, or how consumers behave, or, all the types of information we can have will provide, more context and more nuance in how we can make these risk assessment decisions. So I think continuing to have those, discussions as we move forward and continuing to collect data. I mean, as a methods person, I always like more data, right? And if we can get more data published and out for the community and everyone to understand really the dynamics of these pretty complex systems, I think that will always be a benefit for us to understand, how our decisions are based. Sometimes we do have to make decisions without perfect information. That's always true, I think, in any food safety system, right? So as we continue to make more data and continue to make more measurements and have better understanding, we can continue to refine our decisions and our application of risk assessment. But I think it's impossible to wait for the perfect amount of data, because that's never true, right? I mean, I think for a lot of microbiological hazards, we see that over time we learn more and more and more and can do better and make better decisions for consumers.
Thanks a lot. I think we have reached at the end of our webinar. We cannot take any more questions. So if we didn't get to yours, we will try to get back to you by email. Thank you very much to our audience for actively participating in this webinar. And once more, I would really like to thank our speakers for sharing their insights, their expertise from different aspects of allergen labeling, from the side of research, from the side of practical implementation from the industry, and understanding from the consumers. And we hope that our participants could take back some of those insights and make best use of it. So thank you very much for joining us today on this discussion on allergen labeling, and we hope to see you again sometime soon on our discussions. And we hope that you had a good time and you learned something from these discussions today. So thanks a lot.
Thank
A
you.
lot.
Thanks, everyone.
Thanks.